What's the rationale behind severely restricting the lives of 5 million Melburnians?
Well, it does go down to that critical decision point, and we have to have the confidence about that critical decision point. We are on track. Mystery cases, for example, there'll be 3 or 4 dropping off in the next few days. We could well be at 5 early next week. With respect to managing each and every one of these households and their associated contacts and secondary contacts, that is all being managed really appropriately. The only question at the moment is that are there hundreds of people who have test results to come back who could potentially turn up positive, who are unaware of that status and who would therefore have their own contacts and secondary contacts. And if you're making a decision about those changes to restrictions that would have many of those people moving around much more significantly, then getting those results and being able to say, right, you're a case, you need to isolate, you are the dozens or hundreds of contacts and secondary contacts, you need to be in quarantine. At that point, then you can have real confidence about changing those restrictions. So I still think we're on track. I still think we're just deferring, hitting the pause button for 24, 48 hours, and that's it.
Former Health Minister Jenny Mikakos has just tweeted, she said, Vic has met the under 5 threshold, which some thought was unachievable. This was a very cautious target. 6 of the 7 new cases are related to a known outbreak, so the risk is manageable. The set reopening is gradual and safe, so any delay is unnecessary. She was the former health minister. Surely she's got to... she knows what she's saying.
Yeah, and she's entitled to that opinion, of course. We are just asking for 24 hours, 48 hours to see really significant numbers of tests come back when we know that there are 11 households, but there are still some clusters within the broader outbreak where the linkages between those households are not known.
So clearly you just don't have confidence that you can contain this outbreak.
No. Containment is absolutely something I'm confident about. What I am not confident about at the moment is the cases whose test results have not come back. We cannot contain what we haven't identified yet. So there are some results to come through in the next 24, 48 hours, at which point those individuals, if there are some, and I'm sure there'll be a few, can isolate, and their close contacts and secondary contacts can quarantine.
Your roadmap outlined, maybe this is a question for the Premier, that we would be able to reopen by now. We're less than 5 cases. It's October 26th tomorrow, and there's 1 outbreak, and we can't reopen. There's 1,000 people losing their jobs every day. This is just devastating to businesses. We've constantly been looking for hope. We're here today,
sure.
And we can't because there's an outbreak.
In front of you, these numbers in front of you and these linkages. If Melbourne was already open and then this data came in front of you, would you ask it to close down, or is it?
No, I don't think so. I think our response is exactly as we're doing now. If we saw these cases, we would work on the presumption that they all need to be isolating. We need to go to that very broad ring, double ring of contacts and contacts of contacts. We're coming out of a phase now where we know that there were undetected chains of transmission through all of the mystery cases, the over 4,000 mystery cases we've had through the 20,000 cases in this wave. So we know that we're coming off a giant wave where there are still chains of transmission that haven't been identified. They are trickling away to nothing. When we get to a point down the track and we see an individual case, we won't have a concern that there are potentially a dozen other chains of transmission. We'll have much greater confidence that that's all there is, and we'll be jumping on it. Right at this point in time, we just need that assurance that there aren't these other chains of transmission that haven't been identified, that's all.
So if it wouldn't be enough to close if we're already open, why keep us closed now?
Because of that very fact, because there might be these additional chains of transmission, mystery cases that just haven't come forward, that they're showing in some way linked to this college, but they're not all connected at the moment. And so going to that broader sweep in terms of testing is really a magnifying glass on that entire area and the networks of people to make sure that that's the case.
So in the early days of this pandemic, we were told of good reason that there was no playbook for this. This is something that nobody knows about. This is months later. There's now data from overseas. more importantly, there's data from Victoria. How much of the decisions are being driven by the data, and how much is the art of public health to back a hunch on where they go? Do you specifically look at numbers and say, this is the action that's required from this set of data? Or how much of that is on interpretation? So the differences between the decisions made earlier to what we have today.
Well, we're certainly much better informed by the data. We know there's greater predictive value in all of the elements that we look at. Those cases of unknown acquisition, the average daily number, and the way that they're all connected. But also in the response, all of the indicators in our case and contact management and outbreak management, we're just hitting the mark for all of those, and we know that from the time of symptom onset to the time of isolation is a critical factor. We know that from the time of testing to the time of isolating or quarantining those close contacts is a critical factor, and we're at the shortest period that we've ever had right through Wave 1, Wave 2, we're at the shortest period that we've ever had. So those are additional hard data inputs that give us confidence about outbreak management, about case management, but that doesn't address people who've never come forward for testing, people who are out there who we haven't identified. And so this next 24, 48 hours is really about those last few.
So how much of today's pause is based purely on data? This is the number that puts us here, versus how much is a hunch or a interpretation of that data to hold back?
Well, it's neither. It's really just knowing that we have done a big sweep of testing to get a really detailed look at what's going on, knowing that it's manifested in different settings, not all linked together, so that we can complete that picture and make sure that people aren't about to move about not understanding their status as a case, as a close contact, and that's what the results through today will bring us.
Then just lastly on that, how hard is it when you, I mean, how do you feel making a decision like this that, you know, as I said to the Premier, this surely goes beyond frustration for most people. How do you feel when you make a recommendation like that?
It's definitely hard. I want to emphasise, I'm sure the frustration is a boiling point. I want to emphasise that we are on track, that these cases and contacts and outbreaks are under control, but it's entirely appropriate to have that pause for 24, 48 hours to get a picture that allows for the complete control. You can't control what you haven't found. And it's all the people who've come forward for testing that will identify those cases. That means that we can totally control it.
So do you think there's still a good chance that the 1st of November is possible?
Absolutely. Absolutely. As I've said, we are on track, but it is appropriate to get the data in.
But is it awkward for you to make that decision when we have the former health minister that's saying that we should be opening? We've got the New South Wales Premier, the health minister saying that we should be opening over there, the federal health minister, and also the PM, and also the WHO saying that we should be open. Is it awkward?
So amongst that list of individuals and organisations, none of them are in the tent. With all of the data that we have, with all of the understanding that we have of each and every case, who their close contacts are, how they're linked, the specific complexities with each and every household. Our team's aware of that. They are of a united view that this is, as frustrating as it is, that this is an appropriate 24-hour period to go through.
What else is in the tent that we don't know about?
There is a whole bunch of data that we are sharing with you every day. The cases, the close contacts, the secondary contacts, we're sharing all of that. We can't tell everyone's individual story. That would be a breach of confidence. But we know that there are complexities, and we know that there are some households that are not yet linked. We're being upfront about that, and we are being upfront about the fact that this broader testing is to try and find those additional links, and we will have the answer, and we will be broadcasting it tomorrow and the next day.
How is it that your health advice was that it was safe for more than 1,000 people to go to the Cox Plate on Saturday, but it's not safe today for hospitality and retail?
So there are a number of workplaces that have always been operating for a bunch of reasons, and they've been permitted industries for a very good reason. They've been worked through by the Department of Jobs, and those workplaces have had high regulatory oversight in order to manage the safety. And the Cox Plate was an example of a workforce that needed to be there for the management of that. There were additional attendees who were flagged to attend. I think the Minister has spoken of the fact that that was the wrong call to make in terms of community expectations. I think that's right.
Nonetheless, your advice was effectively that we could have hundreds of people, some of whom would have been there for social and not reasons for the race to go ahead, and yet, you know, the corner store on High Street that might be a clothing shop with 3 people coming in, you're saying it's not safe for that to open. It doesn't seem to make much sense.
So I'm just talking about the permitted industries, and the COVID safe plans that are in place, the work safe inspections, the authorised officers that go out, all play a role in making sure that those workplaces can be run safely. And I think for the workplaces that are operating now, we do have confidence, but the questions about all of retail or entire broad other industries are about the aggregate number of people working, and we'll make a decision about those, and they will be up and running very soon. But the decision today is really about awaiting some additional data.
Are you aware of
are
links
asymptomatic?
between the northern suburbs cases and the Housing Commission towers in places like North Melbourne, Flemington and Carlton? And I guess, is some of your caution motivated by a fear of the virus getting back into those environments?
No, I don't think so. There will be some individuals who are resident in public housing, including in other towers. That's a reality across Melbourne, but they are managed very proactively now. I think the residents of all of those settings have had ongoing engagement now with the department for months and months. There's been a lot more emphasis on prevention and control in those settings, and there's a real willingness and engagement about everyone anywhere, including in towers, to come forward for testing if they're symptomatic. So I don't think the risk is at all the same as it was some months ago, but of course we're asking anyone anywhere if they are symptomatic and if they're linked to these current clusters to come forward for testing.
Can I ask about asymptomatic testing? Because you've mentioned symptomatic testing. Is it worth at this point, and potentially going forward with future clusters which you've flagged that we will see, is it worth doing asymptomatic testing in hotspot locations where you see an outbreak like this one, and specifically with this one?
Yeah, and we're doing it. So we're asking everyone who's linked at the school to come forward regardless of symptoms. So there will be more and more of that going forward. It'll be a really routine part of that broad sweep of testing when there are small clusters or indeed cases. It needs to be targeted where there is transmission. Otherwise you're getting more false positives than true positives if you're testing a big population where there are no real cases. But we're doing it here, we're doing it in industry as proactive surveillance, and it'll be part and parcel going forward.
You couldn't do sentinel testing in geographical areas?
I think if there are cases there, if there's transmission there, I think it's reasonable. But you know, the case in point for this outbreak is that it might be the northern suburbs, but the geographic spread is really enormous. It covers hundreds of thousands, if not millions of people.
Why are you saying we're still on track when we've reached our target to reopen?
So we're on track in terms of the average daily cases. The mystery cases is still above the target that was in the initial roadmap. We haven't hit that, but I think we're on track to hit that. I think we'll hit that in the next few days. And as I've said this week, I'm not so concerned. There are a few of those mystery cases that I think are unlikely to be true cases, and there are a number of mystery cases that are dropping off in the next couple of days.
Have we gone wrong in Melbourne? Why is it in Victoria that we've been in lockdown for such a long time, the longest in the world? We're at the targets you've set out and we just still can't reopen. What have we done wrong?
Well, so our lockdown hasn't been the longest in the world. There are a dozen or more countries that have had longer lockdowns. There are many countries that have had stricter lockdowns, and there are some countries that have had longer and stricter lockdowns. So we're not by any means the longest in the world, and we've gone through a period of opening recently. We're also going in a direction that very few countries in the world are going through right now, and so we have to have gone through this to get to the low case numbers to ensure the long-term success. The successes, you know, and the Czech Republic was lauded. They had a celebration, I think, in the middle of Prague to say we've beaten coronavirus. They now have the highest case numbers and death numbers per capita in the world.
To suppress coronavirus.
Correct. All I'm saying is that there's been complacency in places in the world where they've thought it's been beaten. We are moving to a point where we're not just beating it, but we're keeping it beaten into the long term.
There was some good news for gyms regionally. It says here, third step, Tuesday the 27th of October. But when will Metro Melbourne have an indication of when gyms can?
I think Metro Melbourne has always followed just a little bit after regional Victoria. So I think gyms are absolutely on the radar for Metro Melbourne at an appropriate point as well. We'll see what this week and next week shows. But much like regional Victoria, if these settings can be ensured and all of those COVID-safe practices can be put in place, then gyms can come online at the appropriate time in Metro Melbourne as well.
We'll hear more about that come Monday or Tuesday's announcement.
Yeah.
So let me just go back to a question.